A beautiful sunny day in Cape Town, and I just want to catch up with the Premier of the Western Cape, Alan Winde. Thank you so much, Premier, for your time this afternoon. The weather looks beautiful, but of course we have to talk about issues related to the Easter weekend. This is Easter Monday. People are wrapping up their Easter festivities. What can you tell us in as far as the trauma cases? Because of course a lot of people had to stock up alcohol just before the close of sale for off-site liquor. We know that is often linked, of course, to the increased number of trauma cases at hospitals. What are we looking at over the period of the Easter weekend?
So the Easter weekend, over 500 cases in 12 of our hospitals across the province. And of course, trauma is from the real, from gunshot wounds or stabbings or car accidents, down to someone, needing stitches because they've fallen while kicking the soccer ball. But of course, those are the ones that worry us, the ones that are related to either traffic crashes, violence, crime, those kind of things. Those are the hectic ones. So, but according to the system, and of course the weekend's not over yet, it is still actually a little bit quieter than a normal Easter weekend, and I'm just hoping we keep it that way. Just, those that are still traveling to come home after the weekend, please travel safely, because, we really don't want to overburden our hospital system. We're still in the middle of a pandemic, and it might be in the low trough, but still, we're watching those numbers as well very closely.
Now, a lot of people have criticized the national government about its vaccine program, many of them saying it doesn't exist. We know that the Western Cape has been for quite some time pushing for an independent procurement of the vaccine, but you said that, of course, you're open to sharing it with other provinces, although you just want to make sure that you have a contingency plan in as far as securing the vaccine for the Western Cape. How far are you with that, and what would you say then to remarks that suggest that Cape Town or the Western Cape just wants to be independent from all the other provinces in the country?
Well, I first want to react to the want to be independent. Definitely not. I'm a proud South African. But I'm also a South African who has a mandate from the citizens, and my job as a duty of care is to the citizens of this province. So I must do everything in my power to make sure I help to keep people in this province safe. Whether it's our safety plan, and making sure that perhaps there's a shortfall of policing numbers, I've got to step in there. And of course, when it comes to vaccines, we need to get back to work, we need to get on with our lives, we need to save lives. And of course, these vaccines are going to help us. We've got a year, this year, where we see the rollout of vaccines, but definitely the shortfall, I want to fill it in. Of course, it's not an easy market out there. There are hundreds of countries trying to buy vaccines at the moment. I've got a report coming up. We've got I've been told there's 28 companies and suppliers that have been contacted, so we'll see what that report comes back as, which should be back. They were supposed to come in by the end of the month, so this is the start of a new month. I'll get that report this week. I've also been contacting foreign countries, partner provinces in other countries. If you've got excess, please, we want to buy them from you. So we really are working hard, at the same time making sure that we've got the rollout in place. We're already sitting at 50,000 vaccines, 50,150 was the last time I looked this morning, on our healthcare workers. We've got the next tranche, which will be about another 30,000, and we're working on a couple of other things as well.
Okay, so are you still going ahead with securing a vaccine for the Western Cape province? You're saying there's going to be a report that's going to be handed over to you next week. Tell us exactly what at least members of the Western Cape should anticipate in as far as that process is concerned.
So, of course, I'm trying everything that we can. I don't know what those answers will be. They might say, yes, we've got X, Y, and Z. We've always said that they have to obviously be SAPRA approved. So, I mean, if they can buy vaccines that aren't approved, that doesn't help me either. We've got to make sure that we are, busy working with those that are nearly at approval, or also saying if these are, they've got to be submitted for that approval. Let's see what that report says. It'll give me an update of where we are. We'll tell everybody where we are. We'll do our Digicon this week as well. I've always believed in open transparency around COVID-19. But you'll have seen our finance minister in the province has made a budget available now for vaccines. We've got a contingency budget available, 1.7 billion for this year, to make sure that we mitigate as much risk around COVID-19 as possible.